Diagnosis and treatment of exertional heat illness. Exertional heat illnesses are a spectrum of illnesses that occur due to heat exposure. These are commonly observed during summer workouts when athletes are exercising in heat for prolonged periods of time. Different forms of exertional heat illness include heat cramps, heat syncope, heat exhaustion, and heat stroke. For the purpose of this video, we will be looking specifically at heat exhaustion and heat stroke. Heat exhaustion is characterized by the inability to continue exercise. Signs and symptoms associated with heat stroke are a rectal temperature less than or equal to 104 degrees Fahrenheit, syncope or collapse, dizziness, confusion, dehydration, lightheadedness, and hot and wet skin. Heat stroke is primarily characterized by a rectal temp of 105 degrees Fahrenheit and obvious CNS dysfunction. The signs and symptoms associated with heat stroke include a rectal temp greater than 105 degrees Fahrenheit, personality changes, combativeness, dizziness, dehydration, headache, and hot and wet skin. As we can tell from the previous slide, patients with different forms of EHI present with similar signs and symptoms. The context in which the condition occurred can often help with a differential diagnosis. For an athlete that collapsed and has CNS neurologic changes, an athletic trainer must complete a differential diagnosis by taking a rectal temperature to accurately assess the athlete's core body temperature. Rectal thermometry is the gold standard in assessing body temperature of an individual with exercise-induced hypothermia. Other devices such as oral, temporal, axillary, and skin temps are not accurate and should not be used. When performing a rectal temp, remove the patient from the playing field to a shaded area and drape appropriately with towels or sheets for privacy. Position the patient side-lying with the top knee and hip flexed. Clean the thermistor probe with isopropyl alcohol. If needed, you can also lubricate the probe. Turn the thermometer on and then insert the probe 4 inches past the anal sphincter. If you meet resistance while inserting the probe, stop and remove it and then try again. Leave the probe in for the duration of the treatment. After the treatment has ended, remove the probe gently. In the event that the athlete is being transported with EMS, leave the probe in. For heat exhaustion, treatment consists of moving the patient to a cool and shaded area, rehydrating the patient orally, removing excess clothing, and cooling the patient with ice towels. Additionally, we should monitor their vital symptoms and signs continuously. For heat stroke, the gold standard is cool first and transport second. The best way to rapidly cool a patient is via cold water immersion. The cold water tub should be 35 to 55 degrees Fahrenheit, and the patient should be immersed until their core temperature is less than 102 degrees Fahrenheit. During this time, we'll be monitoring their vitals such as their rectal temp, their heart rate, and their blood pressure. Following the cold water immersion, the athlete will be transported to the local hospital for further evaluation. Total treatment time for cold water immersion should be anywhere between 10 to 15 minutes. If a cold tub is not available, an alternative rapid cooling method is the taco method. During this method, 5 to 6 people are used to splash water and ice on the athlete as the head AT holds the athlete's head above the water. This is done for approximately 10 to 15 minutes until the athlete's core body temperature reaches 102 degrees or lower.